Attaching the system to the pole. Prior to setup, ensure the Evolution pole mount is securely attached to the IV pole using the locking knob. Place the sliding bracket, which is included in the system packaging, over the square post of the Evolution pole mount. Once the sliding bracket is entirely on the square post, tighten the locking knob. Mount the Limitorr system onto the sliding bracket. Insert manifold into slot of pole mount and tighten the knob. When the Limitorr system is properly connected to the pole mount, the yellow indicator of the pole mount will align with the drip level of the Limitorr system. Precaution: the Limitorr volume limiting external CSF drainage and monitoring system must be in a vertical position for the volume controlling valve to function properly. The system should not tilt more than 5 degrees in any direction. Priming the system prior to attaching tubing to ventricular or lumbar catheter. Strict aseptic technique should be used during initial setup, at all stages of utilization and maintenance, and any time the system must be accessed, changed, or otherwise manipulated in any way that opens the closed system once it is connected to the patient. First, check that all fittings on the Limitorr system are tightened. Turn the pressure transducer stopcock to open to the patient line. Attach 10 ml syringe filled with preservative-free sterile normal saline to transducer stopcock port and prime tubing of patient line to catheter connection. Reorient stopcock off to patient line. Keep the 10 ml syringe attached, the pressure transducer stopcock to open to graduated burette and off to patient line. Prime tubing allowing 2 to 3 milliliters of saline to collect in the graduated burette. Drain 2 to 3 milliliters saline into the drainage bag. Do not fully drain out of the tube between the burette and drainage bag after priming. This can result in an airlock that delays draining. Remove 10 milliliter syringe and replace with sterile end cap. Leveling with the line level. The line level is attached by inserting the fastener into the circular opening located on the back of the pole mount at the level of the zero reference point. Once attached, the system can be leveled with the line level by pulling the string taut to the anatomical landmark and aligning the bubble in the viewfinder. Note, this step can also be performed using the Limitorr laser level. Setting the pressure level and securing the system. To establish a zero pressure level, use the Integra laser level or line level to align the zero reference on the Evolution pole mount at the external landmark of the patient as ordered by the physician, such as the foramen of Monroe for ventricular catheters. To set the pressure height, align the yellow indicator with the prescribed drainage level, either in centimeters H2O or millimeters mercury, by moving the sliding bracket. Secure with the thumb screw. Note, the system must be properly aligned relative to patient for accurate drainage. The Limitorr system is designed for use only with the Evolution pole mount, INS 400 series. Caution: the height of the drainage system, relative to the patient, controls the drainage rate, which can affect intracranial or lumbar pressure. Monitoring intracranial pressure. Zero the transducer to atmosphere per your facility's policies and procedures before use. If closed system pressure monitoring and waveforms are desired, the Limitorr system should be temporarily closed to drainage. Note, reorient stopcock to resume drainage. Draining cerebrospinal fluid. To drain CSF, orient patient line stopcock to off to sampling site and orient burette stopcock off to burette as shown. CSF sampling. Sampling of CSF may be accomplished at various sampling sites according to hospital protocol. The SmartSite needleless ports can be accessed with any standard Limitorr fitting syringe. Access may be accomplished at the patient line Y site immediately distal to the patient's stopcock or beneath the burette. In addition, CSF may be sampled from the smart site at the bottom of the drainage bag. Do not insert a needle directly into the smart site valve or it will become damaged and unusable.